Welcome back to MedMind. The point where the frontal bone meets the two parietal bones is called A. Bregma, B. Lambda, C. Glabella, D. Asterion. Correct answer is A. Bregma. The anterior fontanelle, A. is triangular in shape, B. disappears at 6 months' age, C. gives an idea of the state of dehydration of the baby, D. becomes depressed when the baby cries. Correct answer is C. gives an idea of the state of dehydration of the baby. Mandibular fossa is a part of A. mandible, B. maxilla, C. sphenoid bone, D. temporal bone. Correct answer is D. temporal bone. Which of the following bones does not take part in the formation of floor of temporal fossa? A. zygomatic, B. frontal, C. temporal, D. parietal. Correct answer is A. zygomatic. Which of the following bones does not contain an air sinus? A. frontal, B. maxilla, C. occipital, D. temporal. Correct answer is C. occipital. The mental foramen is usually located A. below the first premolar tooth, B. between the first and second premolar teeth, C. below the first molar tooth, D. between the first and second molar teeth. Correct answer is B. between the first and second premolar teeth. The dental formula for the milk teeth is A. 2012, B. 2102, C. 2132, D. 2123. Correct answer is B. 2102. The first permanent tooth to appear is the A. medial incisor, B. lateral incisor, C. first premolar, D. first molar. Correct answer is D. first molar. The upper molar teeth are supplied by A. lingual nerve, B. infraorbital nerve, C. middle superior alveolar nerve, D. posterior superior alveolar nerve. Correct answer is D. posterior superior alveolar nerve. The jugular foramen does not transmit the A. inferior petrosal sinus, B. straight sinus, C. glossopharyngeal nerve, D. accessory nerve. Correct answer is B. straight sinus. The foramen lacerum is present in the A. sphenoid bone, B. temporal bone, C. occipital bone, D. none of the above bones. Correct answer is D. none of the above bones. The anterior ethmoidal canal opens A. at the junction of the floor and medial wall of orbit, B. at the junction of the roof and medial wall of orbit, C. in the roof of orbit, D. in the medial wall of orbit. Correct answer is B, at the junction of the roof and medial wall of orbit. The inferior nasal conchus is a part of A. Ethmoid, B. Palatine, C. Maxilla, D. None of the above bones. Correct answer is D. None of the above bones. The floor of the orbit is formed by the A. Maxilla, zygomatic and sphenoid, B. Maxilla, sphenoid and palatine, C. Maxilla, palatine and zygomatic, D. Maxilla and zygomatic only. Correct answer is C. Maxilla, palatine and zygomatic. The two posterior nasal apertures are separated by the A. Perpendicular plate of palatine, B. Perpendicular plate of ethmoid, C. Vomer, D. Rostrum of sphenoid. Correct answer is C. Vomer. The basiocciput and the basisphenoid fuse with each other. A. At birth, B. Around puberty, C. At 18 to 25 years, D. After 40 years. Correct answer is C. At 18 to 25 years. Which of the following statements is not true for the atlas vertebra? A. It has no body. B. The posterior arch is longer than the anterior arch. C. The spine is bifid. D. The superior articular facets are elongated and concave. Correct answer is C. The spine is bifid. The thoracic part of vertebral column. A. Shows secondary curvature. B. Consists of 10 vertebrae. C. Permits free rotation. D. Contains cauda equina at birth. Correct answer is C. Permits free rotation. Which of the following statements is true for the fifth lumbar vertebra? A. The body is the smallest of all the lumbar vertebrae. B. The transverse process encroaches onto the side of the body. C. The distance between the superior articular processes is greater than the distance between inferior articular processes. D. The spine lies at the level of the highest point of iliac crest. Correct answer is B. The transverse process encroaches onto the side of the body. The nucleus pulposus does not receive any support from A. Annulus fibrosus, B. Anterior longitudinal ligament, C. Posterior longitudinal ligament, D. Ligamentum flavum. Correct answer is D. Ligamentum flavum. Which of these foramina does not lie in middle cranial fossa? A. Foramen rotundum, B. Foramen lacerum, C. Jugular foramen, D. Foramen spinosum. Correct answer is C. Jugular foramen. Which of the following dural folds is attached to Crista galli? A. Tentorium cerebelli, B. Falx cerebri, C. Falx cerebelli, D. Diaphragma celli. Correct answer is B. Falx cerebri. Which of the following statements regarding cavernous sinus is false? A. Trochlear nerve passes through it, B. Internal carotid artery passes through it, C. Hypophysis cerebri lies medial to it, D. Oculomotor runs through its lateral wall. Correct answer is A. Trochlear nerve passes through it. In a case of head injury, the person develops black eye. The hemorrhage has most likely occurred: A. Just under the skin of the scalp. B. Under the epicranial aponeurosis. C. Under the pericranium. D. Within the cranial cavity. Correct answer is B. Under the epicranial aponeurosis. The sternomastoid muscle: A. Arises from the mastoid process. B. Is inserted into the sternum and the clavicle. C. Is supplied by cranial part of accessory nerve. D. Turns the head to the opposite side. Correct answer is D. Turns the head to the opposite side. Comment down your doubts if you have any, and also don't forget to comment your final scores. So, that's all from this quiz, but you can continue learning by watching our next video.